Now let's shift our attention back to India. When the pandemic came, India's healthcare industry was thrust into the teeth of the storm. There were many challenges, including affordability, shortage, and access. The gathering storm reordered the industry, but most of all, it had one ominous consequence. Medical inflation shot up tremendously. Now, the Wuhan virus has subsided, but healthcare costs have not come down. Medical inflation is still soaring. A new report is out. It says India's medical inflation stands at 14%, more than twice as high as the retail inflation. It is also the highest medical inflation in Asia, more than that of other countries with high medical cost trends, like China, Indonesia, Vietnam, and the Philippines. And medical inflation affects everything from the cost of medicines to medical treatments and procedures. For instance, India's cost of hospitalization has more than doubled in the last 5 years. And this is a cause for concern because medical inflation erodes family savings. It chips away at reserves for emergencies. Let me show you how. 55% of all hospitalizations in India are financed through household savings. 23% are done through borrowings. Some borrow through credit cards and loans, some sell family gold, so the situation is dire. And this is why people avoid seeking medical care. 59% Indians skip their annual health checkups. 90% neglect regular doctor consultations. People push tests and procedures aside. They wait for symptoms to get worse, which only drives up the costs. And every year, 7% Indians are pushed below the poverty line because of this, solely because of medical bills. In fact, in 2018, 55 million Indians were pushed into poverty because of medical bills. This is cruel and unfair beyond measures. But it is no wonder, because nearly 70% of health costs are paid by citizens out of their pockets. This involves both rural and urban areas. 82% of urban households are not covered under health insurance. Even with insurance, problems persist. For starters, patients continue to pay out of their pockets, because most insurers do not cover all expenses, like those of medical aids used during surgery. And secondly, medical insurance premiums, or the amount paid for an insurance policy, they've grown steadily. They rose by 10 to 25% over the last 1 year. In fact, health insurance claims have been growing faster than medical inflation. In the last 5 years, average claim for infectious diseases rose by 160%. For cataract treatment, the claim rose by 54%. And that's not all. Treatment costs are also escalating fast. So an average health coverage is inadequate in every 5 years, especially for those who depend on their corporate covers, because companies buy a group coverage where the cost remains stagnant despite the increase in cost of medical treatments. And this is a multifaceted problem, but the result is as uncomplicated as it gets. Medical inflation is burning a deep hole in people's pockets. It is taking an immense emotional toll, and it can't be business as usual. This is healthcare we're talking about. Employers need to do better. India has a workforce of 522 million people. Of this vast landscape, only 15% receive health insurance support. The government also needs to step in. The burden of healthcare expenses is disproportionately affecting India. This is a race we do not want to win. It's a policy issue. It's not a personal finance problem. Every citizen has the right to health. So how long before they aren't one hospitalization away from financial ruin?